Because collecting blood samples brings a risk of exposure to blood-borne pathogens, using proper technique and protective devices ensures the safety of healthcare workers and participants.
That's why it's important to learn or refresh your knowledge on the correct way to collect blood.
Our goal is to do it once and do it right the first time. When this happens, you'll save time and effort and inflict less pain on the participant.
Collecting and assessing accurate information is very important. A client's eligibility in WIC or other programs may depend on it. And if results are abnormal, additional counseling and referrals may also be necessary.
Making your participant feel comfortable is important too.
When you're confident about your blood collection, you can do it once and gather accurate results quickly. First, let's talk about safety and universal precautions. Here are the facts. Universal precautions are safety guidelines developed by the Occupational Safety and Health Administration, or OSHA, and the Centers for Disease Control and Prevention, or CDC. These guidelines help to protect workers who handle human blood and other potentially infectious body fluids. Human blood and other body fluids should be assumed to be infectious with blood-borne pathogens, such as HIV and hepatitis, and therefore the strictest measures should always be practiced when handling blood or other body fluids.
There are two major types of universal precautions. One is the use of barriers, the other is prevention of stick injuries. Let's look at universal precautions that are specific to blood collection.
Wash or sanitize hands. This practice includes good hand washing techniques or the use of an approved hand sanitizer. Wear disposable gloves. Disposable gloves are an example of a universal precaution barrier. Additional examples used in other programs would include other personal protective equipment or PPEs, such as lab coats, glasses, goggles, and face shields. Barriers lessen your risk of accidental exposure. Use lancets as intended. Some lancets are designed differently for children and adults. Read package labeling and use the right lancet on the right client. The right tool for the right job. Dispose of waste properly. Use sharps containers for anything used in blood collection that could puncture a plastic bag, such as lancets, capillary tubes, microcuvettes, etc. Use biohazard containers for other used contaminated waste, such as gloves, gauze, and Band-Aids. Other good pointers include, in the blood collection area, do not apply or put on makeup, do not change contact lenses, and do not eat, drink, or smoke.
Equipment and supplies. Assemble the items you will need before you perform the collection. The following supplies are needed when obtaining blood samples, regardless of the type of test being performed. Latex or vinyl gloves with or without powder. Alcohol, 70% isopropyl or alcohol wipes. Gauze squares. Disposable lancets, adult and child size. Sharps container, and a biohazard waste container.
If you're doing a hemoglobin test, you'll need the following items: hemoglobinometer and microcuvettes. If you're doing a hematocrit test, you'll need these items: centrifuge and hematocrit reading device, or hematostat, capillary tubes, and plastic clay sealant. We'll talk about these tools and their uses later.
Prep steps. Let's go over the preparation steps, or prep steps. First, begin with a clean work area. It's recommended to prepare the work area with a protective barrier. This barrier can be paper towels, absorbent paper, or a plastic back pad. Using a barrier reduces the risk of contamination and makes cleanup easier. Calibrate your equipment when necessary, like at the start of the day, or when there has been a power interruption. Be familiar with the manufacturer's instructions for the equipment that you are using. The equipment must be calibrated in accordance with the manufacturer's recommendations and instructions. It is WIC policy for clinic labs with a certificate of moderate complexity to calibrate equipment twice a day. The results are to be recorded in a maintenance log.
Let's talk about hand washing. The ideal situation is to have a sink with hot running water, liquid soap, and paper towels.
In less than ideal situations, when soap and running water are not available, use hand sanitizers. Gather your supplies and materials. Have your blood collection equipment and supplies ready. In case you have to do a repeat collection, it's a good idea to keep a few extra items within reach to avoid delays. And lastly, let's glove up. Now we're ready to collect a blood sample.
Good morning, how are you?
Now you can greet the participant and verify their identity. Have them sit comfortably in a chair and explain the blood collection procedure. If the participant is a child, ask the parent or guardian to hold the child on their lap. To further aid the process, ask the parent to hold the child's arm at the elbow during the procedure.
Puncture sites. Two common skin puncture sites are the finger and the heel. The heel stick. Heel sticks are commonly performed on infants and newborns. For infants, up to their first birthday, it is recommended to use the heel since it has a larger surface area and is easier to grasp than a tiny finger. The heel may also be easier since some infants have a tendency to make a tight fist, which can be difficult to unfold. Heel stick punctures should be performed on the sides of the heel. Notice the shaded areas. That's the area where it is okay to stick. Be careful to avoid the base of the heel because there's bone close to the skin's surface. After the age of 1, or when an infant begins to walk, the heel side is no longer recommended because the sole of the foot becomes calloused and tough. Finger sticks are more appropriate for adults and children who are walking.
The finger stick. Which are the best fingers for finger sticks? The ring finger and middle finger are the best choices. Avoid the thumb, which is usually calloused, and also the little finger, where the bone can be surprisingly close to the skin surface. Where on the finger should you puncture? The fingertips are a poor choice because of the large number of nerve endings, as well as a small concentration of capillaries. Instead, the puncture should be made to the side of the finger pad. This area is typically less calloused and the skin is easier to puncture.
The stick procedure. Warm the site. When participants are cold, their blood may not flow well enough to collect a good sample. Often clinics are air-conditioned so that it is uncomfortably cold for many participants. If you can warm their puncture site, the hand or foot to be stuck, you can increase blood flow by at least 7-fold. To warm the site, you can rub or massage a participant's hand, or they can rub their own hand. The participant can make a fist and relax it several times to get the hand warm and blood flowing well. Remember that if the specimen is for testing lead, then the hands of the child must also be washed with soap and water before using the alcohol swab. Clean the site by wiping it with an alcohol swab or 70% alcohol and gauze. Wipe the site dry using gauze, unless the equipment manufacturer's instructions specify to allow the skin to air dry. Do this to prevent contamination of the sample and to avoid the stinging sensation to the participant. Gauze is recommended over cotton balls because cotton may leave microscopic fibers that can clog capillary tubes and cuvettes. And never blow to dry. Puncture the skin using a disposable lancet. Follow the lancet manufacturer's instructions. Be sure the lancet makes contact with the site. Good blood flow is essential. Removing the lancet too soon can result in a poor stick and inadequate blood flow. Fight the urge to pull away to avoid hurting the participant. Having to stick them multiple times is much more painful. Carefully dispose of the lancet into a sharps container after use. It is important to handle lancets and other sharps as little as possible to decrease the risk of a stick injury. Wipe away the first blood drop or droplets with a sterile gauze pad. Follow the manufacturer's instructions to determine the precise number of blood droplets to wipe away.
Blood collection. Position the hand at a downward angle to allow gravity to increase blood flow. Wait for a spontaneous flow of blood and collect the sample. Do not milk or squeeze the finger, as this can cause hemolysis, leading to inaccurate results. Wait a few seconds for a spontaneous flow of blood and collect the sample. Place the capillary tube or cuvette at the edge of the blood drop and fill with one continuous draw. Do not break contact with the drop of blood. This could cause air bubbles which may adversely affect the reading. For a hemoglobin, fill the cuvette until full. Wipe any excess blood from the sides of the cuvette using a gauze square. Place the cuvette in a hemoglobinometer and follow the manufacturer's instructions for operation. Read the display results and record them on the applicant's assessment form. For a hematocrit, stick the capillary tube to the blood droplet. Capillary action will cause the blood to fill up the tube. If you're using an uncalibrated tube, fill it to at least 1/2 to 3/4 full. For calibrated tubes, fill from the end away from the calibration mark to the calibration mark. Whenever possible, obtain 2 samples. Wipe any excess blood from the outside surface of the capillary tubes using a gauze square. Hold the tube between your thumb and index finger and rotate 5 to 6 times to mix the anticoagulant. Seal the end of the tube with the plastic clay sealant. Place the tube in the centrifuge, clay side out, and spin. Be sure to follow the manufacturer's instructions for operating the equipment. If using a hematostat, it is acceptable to read hematocrit values displayed on the built-in analyzer. Record the value to the nearest whole number on the applicant's assessment form. If using a centrifuge, calculate the result using a hematocrit reading device. After a blood sample is collected, press a gauze square to the puncture site until bleeding has stopped. Clean up any blood splatters or spills and properly dispose of used supplies. In WIC, after hematocrit or hemoglobin values have been determined, a certifying authority will assess the values to identify whether screened participants are at risk for anemia or not.
Special considerations. Okay, it's inevitable that you're going to encounter a scared or non-compliant child who can't or won't follow your directions to be still. So let's go over some techniques in handling and the use of gentle restraint. It's generally recommended to hold a child's arm firmly at the elbow. This prevents the child from swinging the arm around and possibly hurting themselves or others. For combative children and escape artists, the parents should be instructed to tuck the child's legs between their own. This protects the staff from being injured and reduces the chance that the child will get away. Work fast. Some collectors can get their samples before participants even know they were stuck. And if none of these tips work, you always have the option to stop services and reschedule participants. Reschedule children who attempt to kick, bite, and spit. Remember, our first concern is safety, and that includes staff as well as participants. For a non-bleeder, you can increase blood flow by trying one or more of the following 3 tips. Warm the hand by gentle massage. Have the participant make a fist. Release and repeat. Lower the participant's hand, letting gravity help with the blood flow. If you have a participant who continues to bleed after you have completed collection and applied pressure at the site, try raising their hand above the heart. Adhesive bandages or Band-Aids should only be used if there is excessive bleeding. In very young children, there is a serious risk of choking with bandages, especially the spot type. If you feel that a Band-Aid is necessary, explain the risk to the parent and caution them to remove the Band-Aid before leaving the clinic. Point out trash receptacles for proper and responsible disposal.
Cleanup. Let's talk about cleanup. Be sure to use a disinfectant to clean. Clean soiled or potentially soiled areas with a disinfectant approved by the EPA, or use a solution of 1 part chlorine bleach to 10 parts water. Clean the equipment following the manufacturer's instructions using an approved disinfectant. Note that some cleaners may damage the equipment. Clean the work area even if you don't see blood. Microscopic droplets may be present. Let's recap. Wash or sanitize your hands. Gather your supplies. Put on disposable gloves. Use an alcohol swab or gauze with 70% alcohol to cleanse the puncture site. For infants who are not yet walking, the sides of the heel are recommended as puncture sites. For children and adults, the middle or ring finger are recommended to the sides of the finger pads. Use warmth and gravity to help with the collection. Do not squeeze or force blood from the puncture. Fill capillary tubes, cuvettes, and microtainers to the correct volume. Dispose of waste properly. Clean up using an approved disinfectant. Refer the participant to their healthcare providers if results are abnormal.
Always remember that blood collection brings a potential for exposure to blood-borne pathogens. The best insurance is to practice proper procedure and to use recommended safety equipment and supplies such as disposable gloves and sharps containers.
Your technique and confidence will improve with each new sample you collect. Very soon, you will be collecting samples like a pro.
Remember, our goal is to do it once and get it right the first time.